Welcome to LYME Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Oh, LYME Time. You are in for a treat today. Today, my guest is Dr. Eboni Cornish, the Functional Medicine Director at Amen Clinic's East Coast Division. Dr. Cornish specializes in addressing complex health issues such as autoimmune diseases, Lyme disease, environmental toxicity, neurological conditions, and gut imbalances. Don't tell her I told you this, but she is known as the poop queen, so we've got a lot to cover today. Her holistic integrative approach identifies root causes within biological systems to create tailored treatments for both adults and children. You may have even recently heard Dr. Cornish on Nick Cannon's podcast, Council Culture. She had a really fun discussion with him, and I was just blown away by all the topics that they covered over there. So with extensive expertise and experience as both an educator and guest speaker, Dr. Cornish is a skilled communicator who brings a wealth of knowledge and actionable insights. We are going to get to those a little bit later when we welcome her to the show. Her accolades include being recognized as Northern Virginia's top doctor for family practice in 2021 and 2022, and being honored as an exceptional woman in healthcare by Continental Who's Who. She currently serves as treasurer for the board of the ILADS Society, that's the International Lyme and Associated Diseases Society, and has been featured in numerous health forums. But what I'm mostly excited about is her warmth, her humor, her ability to get in there and just say it like it is. So without further ado, I welcome Dr. Cornish. How did you, Dr. Cornish, come into functional and integrative medicine? What's your story and your journey?
Oh, yeah. Everyone always asks me that. And it's honest. Let me tell you my story, okay? I didn't know what I was getting myself into. All I know is I was bored. I was bored in family practice. I was so bored. And I was a little bit out of residency. So I was looking for jobs and couches simultaneously on Craigslist. And I saw a job that said for doctors that think outside of the box. That's all the title said. This is on Craigslist. And I was like, hey, that's kind of cool. I'm tired of giving metformin every day and blood pressure meds. So I responded to the ad. And at that time, the first practice I worked at, the physician there was a Lyme ILADS doctor, International Lyme and Associated Diseases Society. And it was on the job training. I never heard of Lyme disease. I remember because I did residency in Georgetown, my first patient who was a landscaper who had a tick bite and a rash, and he kept coming back and forth for more antibiotics and treatment. And I remember my attending was like, he's drug seeking. He doesn't need more antibiotics. That one dose should be enough. And I didn't know what that meant. So that was my only experience with Lyme disease and vector-borne illnesses. And I hadn't even heard of any of the co-infections, right? We don't learn that in school.
Wow.
I always tell them, Brown University, you need to give me my money back if you're listening right now. You didn't teach me any of this. So after working in a Lyme practice, I could never go back to conventional medicine. It was just eye-opening. And then after getting into really the infectious piece, I took a step back and I was like, okay, it's more than this. I can't just target bugs. Something else is up. And so that's when I started to do more of the IFM training, which is for functional medicine, which is when you look at root causes. Because I'm a researcher at heart, and I'm also a person who was a detective. I'm like, this doesn't make sense. If Lyme has been around since the cavemen, like, why are my patients so ill? And that's when I started learning about looking at hormones, looking for toxins, looking at genetics, just looking at how the body function. So I started attending conferences, got trained in functional medicine, and that just made me a better doctor. And I found that once I started treating gut and inflammation in your immune system, that made the process from healing from these underlying chronic infections easier. So that's kind of, it was more on the job training and just a question of like both with my standard job, like this doesn't make sense. And then when I first started treating Lyme, and even though I was having some great results just focusing on antibiotics and herbals, I was like, this doesn't make sense. It shouldn't be this hard. And that's when I started looking at the big picture, which is integrative and functional medicine.
And thank God you did, because you know the world is a better place because you continued your curiosity. And I think that even though we're coming a long way slowly with integrative and functional ideas and philosophies and understanding and kind of unraveling a lot of the conventional routes, which still have their place, but understanding this big picture. I also want to mention that a lot of followers and a lot of Lyme patients stop when they see some of the price tags that come along with functional or integrative medicine. Maybe that first initial visit is an hour or even 2 hours long, and they're thinking, oh my gosh, it's such a big price tag. And then some of the treatments that we'll get into in a second, you know, also have their own price tag, whether they're covered under insurance or not. So I try to tell people that because integrative and functional medicine is really getting to the root cause and working on a deeper level of testing and looking at the whole person, I think you're going to heal faster. But you have to buy into it, and you just have to go for it and save your pennies, because at the end of the day, it will probably be cheaper than continuing with the pharmaceuticals that probably, when it turns chronic, are not going to be doing much good for you. Do you have
And I
anything thoughts
agree.
about that?
Yeah, and I agree. And I would take it even a step further. What I always tell my patients, it's this. Yes, we're looking at root causes and we're taking longer appointment times because I need to get to know you. I need to put together the pieces of the puzzle because it's never just one thing. However, when I'm starting patients, like even for example, before we even get to Lyme and I'm doing their hormone assessments, that's LabCorp request. When I'm doing their gut assessments, that's what aren't you putting in your mouth? So that's you taking away the foods that make you toxic and using foods as your medicine, because that's what we derive these herbals from is it's food sources. So if you, I look at it, I always tell patients, look at it as a barter system. The more toxic foods and toxic lifestyles you take out, the cheaper your journey to healing will become. So I'm a doctor. I believe in testing, but I also believe in common sense. And I know that my patients who get better faster, when you say they commit to that process, they go in there and they're like, look, you tell me what I should eat. I want to get my bowels regular. You tell me I need to get my sleep regular. I need to try as much as possible to be on the right track, to stop drinking, to stop the sugar, to stop smoking, to get my hormones stable. I need to set that foundation so that this journey isn't as taxing and as expensive. And those are the patients who do better faster. But the lifestyle is free. You know, you start there. If you focus on resources, focus on your lifestyle. And the barter system, I always tell my patients, I said, hey, the more toxic foods, the more toxins you take out of your life, the more money you're going to save, and the more money you're going to save on me and on taking supplements. Because for every toxic thing you stop doing, I'm going to take a supplement off that list.
Isn't
So, and
that
people
that's
have
a
to just change that mindset
yeah,
because because functional medicine is for everyone. They even have organizations like integrative medicine for underserved. And we have grants, like Limelight Foundation and assistance, because we do know that there is a cost. However, the one thing that frustrates me the most is when doctors just blink. I'm going to give you every out of pocket test on day one that I can ever think of because I want to figure you out, whereby you can use steps and price points to get the answers you need. And more importantly, you can be a clinician and clinically diagnose patients, because especially with vector-borne diseases, a lot of time it's a clinical diagnosis because our tests aren't that great. So I think it requires that we're real doctors, that we listen, that we use our medical equipment, that we use our eyes, and that we educate, with the lifestyle component to make this more meaningful. But I think you're absolutely right. I hear that a lot. And that's one thing that my patients know. I run a tight ship and we do focus on lifestyle, and they're very grateful afterwards because of it.
That can't be underscored enough is diet and lifestyle. In just giving your body a great baseline and a great foundation from which to draw upon the energy, and it basically affects everything. And I think something that's very interesting to my listeners is the the combination of Lyme disease, possibly dormant Lyme disease, and hormones. So, in other words, do you find it in your practice that hormones can actually trip up Lyme, be the cause of Lyme, so to speak? Or even if somebody has Lyme and they're going through hormonal changes, how do you see the scope of that when in your practice?
So whenever I'm treating someone, no matter what the condition is, we start with a hormone assessment. It's called brain hormone support. So we set that foundation first. I do a comprehensive analysis because that's key, because your hormones, that's your metabolism. That is what drives, especially in women, our cycles, in men, our endurance with testosterone. And it just gives us our overall brain support. And so if you're treating any type of illness that can affect the nervous system, you have to focus on hormone assessments. Now, you asked an excellent question about how does it interrupt the Lyme or vice versa. For women, hormone changes. Unfortunately, they happen every month, right? It's just what they do. And that shift in progesterone and estrogen that occurs monthly while we're menstruating is stress on our body. It makes our bodies hostile. It's an intentional shift in our equilibrium. Okay. And as a result, your body goes under stress. And what I always tell my patients is, and I ask them, are your symptoms worse on your menstrual cycle or not? Because typically I'll see flare ups that are associated with hormone changes. Now, I also know that hormones are essential, adequate hormone function for brain health. And a lot of women, specifically when they're going through menopause, which is when your period stops, or what I'm going through right now, which is perimenopause, which happens in the late 40s to when your period stops and you're like, what is happening with my body? That's still a stressor, and it can compromise brain function. So I have a lot of my patients who present with Lyme disease and they're like, I have such severe neurological symptoms. And I'm like, well, wait, did we check your hormones? Because yes, it could be Lyme, but it can also be hormones simultaneously, and you can't treat one without the other. So if you're trying to treat Lyme disease and you're ignoring, we're talking, focusing primarily on the sex hormones, you're doing a patient a disservice. And at the same time, you have to do a wide panel that also includes your thyroid, because so many patients who have chronic illness of any kind, especially these vector-borne diseases, you can create kind of an autoimmune problem. And that can lead to thyroid issues, especially. That's very, very common. And I've also seen the bug, which causes the autoimmune, then impact the thyroid and cause hypo or hyperthyroidism. And I've seen my patients who might have Hashimoto's or genetic thyroid imbalances, and it's more difficult to control them, those disorders, because they have this underlying infection that has a lot of inflammation. So it's all about how chronic illness impacts the brain. And the brain is what senses our hormone production. And so, yes, when it's not balanced, there's a problem. And I tell patients, look, if your hormones are unstable, or you're not sleeping, that's step one to healing. It's going to be a very, very long road for you. You can't just go killing things. You have to stabilize the patient.
So if somebody came to you and said, you know, I just found out I have Lyme and I feel like my hormones are going out of control, what would you treat first?
And that's a good point because it definitely depends on the patient. Now, being that I am functional medicine, we're doctors who try to treat everything. So I kind of get myself in trouble at times when it comes to this because I'll do things simultaneously. Because it's not fair for a patient, especially if they're suffering from a chronic infection. It's just not fair for me to say, oh, yeah, by the way, let's let this bug fester and I'll see you later once I stabilize your sex hormones and your thyroid. Sorry, you got to wait. And the same thing holds true for treating infection and neglecting to have optimal hormone support. So it can be done simultaneously, but it is essential. When I train doctors on how to treat Lyme, I tell them it is mandatory that you do these hormone tests for your patients, or you are going to have a very difficult time with these vector-borne infections.
And do you find in your practice that Lyme can bring on thyroid issues, or do you feel like the thyroid issues brings out the Lyme?
So I think it's both,
Mhm.
but the majority of the time, I find because what happens with this tricky cool organisms, these vector-borne diseases, is that they are able to enter into our cells. They make our cells look foreign to something called our immune system. So now we have this interesting bug that shared themselves with us, and now our cells look foreign to our immune system. So then what happens? Your immune cells start fighting you because they think it's something foreign, but that's only because this bug has entered into it. And that's called molecular mimicry. That's the fancy word for it. When that happens, especially in patients with like high risk of developing autoimmune disease anyway, the thyroid, for example, you start to get an autoimmune phenomenon with your thyroid due to this infection. Okay. So now you're having these antibodies fight your thyroid, and you start suffering from those thyroid symptoms like fatigue and weight gain and cognitive impairment and depression. So I think that one, the bug can cause that problem because of this fact it's so tricky. Most of these vector-borne illnesses can enter into your cells and make your immune system go haywire and fight you and cause and trigger these imbalances. And at the same time, if your hormones are compromised, you just don't have the ability to boost your immune system. So it's like a catch-22. They go hand in hand. And I see that with all types. Like I see it with thyroid. I see it with what we call our adrenals, which is your cortisol, your stress hormone. People become just flat. It's called adrenal fatigue. They just become so tired, so sleepy, so depleted. And that's also because of an inflammatory burden that's caused your hormones to be compromised. Okay. I see that with testosterone. I have so many patients, women and men, who come to my office, same thing. Oh, I have neurological Lyme. I have brain fog. I can't focus. Testosterone is low. All right. And that's not giving them that support that their brain and their body needs to optimize immunity. So you have to focus on the basics. And the basics is brain hormone support. And that's just the foundation of healing in general. But it is, they both, it's a bi-directional
What about
communication.
cortisol levels with Lyme disease?
So just to explain to the listeners what cortisol is, if you think of being chased by a bear, or when you exercise real hard, that's your adrenaline, right? You're all hyped up, ready to go. That's cortisol, okay? That's that stress hormone. And it's natural, it's good for us. But sometimes it's too much of it or not enough. So what happens is, going back to that analogy of being chased by a bear and feeling hyper, that's how you want to feel when you wake up. You want to jump up, have a good cortisol, start your day and say, "Ooh, yay, congratulations, it's a new day." And then throughout the day, according to the circadian rhythm, then that cortisol is going to drop down as it's supposed to, so that you get ready for bed and you go to sleep. Now, what happens with chronic infections, especially these tick-borne diseases, is that your body is so stressed in a lot of cases, especially the majority of my patients, and you feel like you're being chased by a bear 24 hours a day and 7 days a week. So your cortisol is through the roof and it's expected. I mean, your body is under stress nonstop, and so many patients are misdiagnosed, not diagnosed, and not to mention the emotional and physical stress you go through from having a disease that no one understands, right? So you're in this fight or flight. You feel like you're being chased by a bear. And that's the cortisol. That's called adrenal fatigue because your body can't keep that up. And if you can imagine, just say you feel chased. When you're running from a bear, are you going to be doing anything else? Are you going to be thinking about cooking dinner or recovery? No, you're scared. And so that's the first step. And then also something that can happen is that you get completely wiped out because your body can't keep up that pace. And that's just called, adrenal crash. You can't get out of bed. You can't move. And then the other thing that I see with the cortisol is that you get so stressed, instead of it being too high all day, it's flatline in a day. And when you're supposed to go to sleep, it's up, it's too high. So your eyes are closed and you're not getting a deep REM sleep. And you're wondering, wait, why am I not, why is this sleep unrestorative? What's wrong with me? I was sleeping for 10 hours and I'm still tired. That's another form of cortisol and adrenal insufficiency. And that is contributed to by these infections because of not only their involvement with the brain, but their inflammation that they cause systemically, which can affect our adrenals.
Sure. And I think a lot of people that have fall into the chronic category, that's a tough one to let go of. And sometimes I call it the last piece of the puzzle because they've worked so hard on their immune system. They've worked on their gut health. They've worked on all these things and their body cannot let go of that adrenaline rush. It makes it very difficult to sleep. It creates ruminating thoughts. And it's sort of like the body's last defense. The body is still holding on to so much illness. And that I believe, and I love the brain retraining prospect during that final phase of healing because it allows you to tell yourself you're safe again. Because I think we actually have to tell ourselves and retrain our brain to coming full circle. So I love this. I love talking about the hormones. I'm just curious to know, well, first of all, so you would feel comfortable treating somebody with antibiotics as well as putting them on supplemental hormonal therapies if they should need to do that. Just go ahead and cover your bases and get started on a healthy body and not worry about overloading it too much. And
So,
go ahead.
yeah, I want to just go back to something you said, which is very important when you were saying about the limbic system, because that's something I'm very passionate about. I actually, when I look at brain imaging, I can see that limbic system that's in overdrive, that part of the brain that's in fight or flight. And so for a lot of my Lyme patients, when I'm doing a SPECT scan brain image on them, and they've come to me and they've, like you said, been through so much, They're so depleted. They've been on tons of drugs, tons of meds. And then we get a brain image and we look at their limbic system and we're like, yes, this is why your body is not responding to therapy because your brain doesn't feel safe to heal. It's in an imbalance of the parasympathetic, these two responses that either keep you in fight or flight, or sympathetic, parasympathetic, which keeps you calm. Like that balance is needed. And I tend to be a believer that you need to know what's going on with the cortisol and limbic system first. Because if not, then you're going to be doing a lot of these therapeutic interventions. And like I said earlier, if you're in fight or flight, your brain isn't going to really be as receptive to the treatment modalities that you're giving them. And not only that, some patients, when they're in that fight or flight, they can't tolerate anything because you give them one drop of any medication and their body just can't receive it. And they're having sensitivities or they're having to quit therapy. Or the other hand, you have the patient who's been on antibiotics and herbals for 10 years and nothing's working. But when you calm that brain, that limbic system, and you get those hormones, then they're more able to have a successful recovery. So I tend to do it first in my patients. I look at brain health and hormone. That's my first step. And so when it comes to doing it simultaneously, it's mandatory that I do. It's mandatory because that's how the human body works. Our hormones are crucial for our immune stability and our resilience. So if you have a deficiency, let's say you're a woman, for example, because we talk so much about perimenopause and menopause. And what that means is your estrogen and your progesterone are low, as well as testosterone, your sex hormones. Libido's low, period's gone, weight's on, mood's down. If I don't find a way, either with natural strategies and or what we call bioidentical, which is when we give you like natural hormones that are from special pharmacies, or I even use plants to support hormones and foods like rhubarb or wild yam root. Some of these plant derived sex hormone stimulating agents, maca root, things like that. They have to get started. You have to support that hormone. You have to support that brain. I mean, it's you can't then skip and try to treat with antibiotics and treat with herbals and then leave the hormones out there high and dry. That's not going to help someone's brain. And quite frankly, by the time they come to my office, a lot of my patients, I'm like the seventh, eighth doctor they've seen.
Yeah.
And that's another reason why I'm like, okay, why aren't they better? And it's like, okay, yeah, you have all these infections and toxins, but your thyroid's low
Mm.
or your cortisol's low. You don't have reserves. You don't have estrogen. So yeah, so that's key that we put that as primary, as a first step. And if there's anyone listening who's not getting better and has been going through all these aggressive treatments and integrative strategies and taking 20, 30 pills twice a day, and you haven't looked at your hormones, that's something you can do with LabCorp Quest. That's covered by insurance, and that's easy to look at.
Good to know. Good to know. And then while we're on the topic, pregnancy and Lyme disease. So always have two questions. The first one is, oh my gosh, I'm actively treating Lyme disease and I got pregnant. And that throws everybody for a loop there. Or I'm afraid to get pregnant because I have Lyme disease and I'm afraid of passing it on to my child. So, do you have any thoughts about those two things?
Oh yeah. So I'll never forget because I started treating Lyme. It's been about 15 years now. And one of my first patients, we call it gestational Lyme. Wonderful. We had a joke that in my office at that time, it was like, don't go to Dr. Cornish's sink in her room because everyone comes out pregnant. I mean, it was like back to back. I just started. I'm this newbie Lyme doc, back to back women getting pregnant. And what I found was one, when it's unexpected pregnancies, as they start getting better, right, your libido goes up. I think the fact that we talk about gestational Lyme, it's more what we call anecdotal, and there is literature to support it. Now, we know that we know Borrelia burgdorferi, literature shows it's transmitted from mom to fetus. And we do have evidence anecdotally that some of these other tick-borne diseases, Bartonella and babesiosis strains, can also be transmitted to the fetus, but it's not 100%. So whenever I have a mom, and like I said, who would go to that exam room and wash their hands in that sink and show up pregnant, the first thing was, okay, look, this is not doomsday. All right. Babies survive. I'm a mama triplets. Okay. So that's scary. It's all get out when I found out that happened. Right. But I had to remind myself a baby, a fetus can be resilient. So, yes, you may have this underlying infection, but that's not a 100% chance that you're going to transmit it. But at the same time, you have to treat Lyme clinically. The wonderful thing today in 2025 is that we have so much testing out there now, tests like T Labs and IGeneX and others who can look for that active organism circulating. T Labs can under microscopy and Fry Labs as well. So that's something I have my patients who have that unexpected pregnancy and those who want to be pregnant say, hey, let's look and see if there might be an active underlying infection because you're going to have antibodies if you have a disease, but let's try our best. And if I can't, let's say resources aren't there, I have to be a clinician. And if it's a mom who's very ill, we have to look at the protocol because let's tell you something, those herbals, a lot of them haven't been shown to be safe to the baby. So I say, look, we're going to do old school. We're going to use the European literature and boost your immune system the best of our ability. We're going to optimize probiotics, gut health, lifestyle. We're going to use a few herbals that might be safe. And if she's extremely sensitive or active, that's when you have the beauty of having antibiotics that are safe for mom and fetus, things like amoxicillin or the cephalosporins. So that might be an approach. That's the one that I take only if I have to, but I usually try to also make sure I'm optimizing, the mom to the best of her ability, her immune system for the sake of her and that baby. And I'll tell you something, I've had tons of women over the years with children, and not all of them have kids with tick-borne illnesses. A lot of these kids are, healthy, strong, robust, but it's bigger than just the infection. Like, what is that mom eating? Is she exercising? Is she sleeping? Is she suffering from chronic pain? Is her gut regular? Is her immune system working? And then, okay, let's make sure if we need antimicrobials, we use them. Now, if I have other patients who want to get pregnant, like Dr. Cornish, it's time. I'm ready. Libido's up. It's time to make this baby. I put them on like the Cornish Pregnancy Plan. So what we do, we think about everything that can potentially cross over to the fetus. And this is not just for Lyme disease. This is what I did myself, just out of curiosity.
And you had
Testing.
triplets.
Yeah,
So
I was like,
buyer beware.
So it was like, okay, let's test for heavy metals. Let's test for urine toxins. May that be mold toxins or others, environmental toxins. Let's test for chronic infection. Okay, because even during pregnancy, we get tested even for strep. Let's test for vector-borne diseases. Let's see where you are. And if it's a mom who I'm treating with Lyme disease and they're on treatment and they're like, okay, I'm ready to get pregnant. And I say, okay, let me take you off all your antimicrobials, may they be antibiotics, herbals, and see how you do at baseline. Because that's really what it's about. How well do you do when you're not on antimicrobials? Because that gives us a sense of how active your disease process is. So patients are very patient with that approach, most of them, because they have a plan. They're like, okay, I understand the literature. I understand this is a risk. It's not 100%. I don't want any patient with Lyme disease or co-infections thinking they can never have a baby, but you do have to use precaution and you do need to work through different steps. And the same thing holds true for breastfeeding. So I've seen success stories, I've seen miscarriages, I've seen difficult pregnancies, but all I know is that I universally have the same rules apply. You prepare, you test, and you make those decisions on an individually tailored basis on if they're going to take antibiotics or not.
Well, all I can say is your patients were in good hands because it's a real fear for women that have gone through Lyme disease. The last thing they want to do is pass this along to their children, and they tend to get stuck in that thought.
Yeah.
And I think that you have a very organized way of dealing with the situation. And yes, it might take a little bit more time and preparation, but you're optimizing the body in order to prepare that wonderful environment for the child. I think that's wonderful. Let's talk about the gut brain connection. And because you're talking about lifestyle changes and you're talking about the foods that we put into our body, a Lyme patient oftentimes is not really able to detox properly. Maybe it's because suddenly you're sedentary and you're bedridden. Maybe it's because you're on a lot of medications. I don't know. It probably differs from person to person, but I do hear a little bit about people that are not able to detox. So then you're disturbing the gut a little bit with that whole process in that you're not able to detox, you're not able to sweat. What's your experience with this? I know this is a fun topic for you, so enlighten
This is my favorite topic. They call me the poop queen. That's my nickname. I have a kind of poop emoji gifts in my office. I don't know if it's good or bad, but I mean, because let me tell you something. Every disease starts in the gut. Gut health is body health. Gut health is brain health. And we have over 35 trillion organisms in our microbiome, which is our gut. All right. And we have about 20 trillion or so human cells. So we're outnumbered by the good and bad bacteria that makes up our microbiome. And that good bacteria, that's what supports our immune system. That good bacteria, that's what calms down inflammation. And even when it comes to your mood, those chemicals that keep your mood stable, because a lot of people can have neuropsychiatric manifestations of Lyme disease, that serotonin, that dopamine, when you're taking all those psychiatric drugs, those chemicals are also in your gut as well. So when you're loving your gut, you're loving your brain. And the brain is one of the ways, one of the main places that patients with Lyme disease have problems, neurological symptoms. But it's a communication. And that's one thing I didn't know really until I started functional medicine, that there is a brain connection by the vagus nerve from your brain to your gut. So whenever you eat something, it's like a telephone tree. Your brain is receiving those signals. And so if it's things that are inflammatory or toxic, then your brain is going to have those inflammatory toxic responses as well. So it's challenging in that people always think, oh, you're telling me to do gut health. That means I got to go to Whole Foods and spend $700 on. No. That's not what gut health is. Gut health is just making sure you're putting things in your body that love you and that love your brain. That means whole foods. That doesn't have to mean, special $20 high price items a piece in your budget. You can get sweet potatoes. You can get vegetables, even if they're frozen, like those whole foods. You can get in fermented foods, which give you good probiotics. You can get yogurts, things that feed that gut, because that's going to also feed your brain, your omegas. So eating things that love your brain, and that in and of itself is going to decrease inflammation. So I don't treat patients unless with antimicrobials unless they're pooping, unless their gut's optimized, because that's what leads to all those detox problems. That's the number one way the body detoxes, through our poop. So people get, oh, I'm on binders, I'm on glutathione, I'm on it. No, are you regularly having bowel movements? Is your tummy flat, or is it bloated? Have antibiotics destroyed your gut microbiome or not? Would someone take the time to rebuild it? Because it's targeting the brain. Toxins are building up if you can't poop, or if you're having diarrhea, you're most likely not absorbing all those things you're taking. And it's going right into the toilet. And then you're sabotaging your healing journey. It's as simple as that. And people, when you break it down like that, and make sure you understand, like, I'm not going to tell someone who comes in my office and they're struggling and they have adrenal fatigue, all the things we've been talking about. I'm not going to tell them, hey, get off your couch and make a 5-course meal from Trader Joe's with all fresh spices. No, I'm going to just basically say, get out and not eat the bad things, but let's find some plans within your means and also whole food options that you can afford so that we start on the right path, and that's the beauty of the gut brain connection. So when they say you are what you eat, that's absolutely right. And because patients who go through treatment for vector-borne illnesses a lot of times have been on antibiotics, chronic antibiotic utilization, their guts are destroyed. They have leaky gut, and that leads to leaky brain. And those bugs get to that brain and cause more inflammation by having disrupted gut microbiome. So it's just as key as hormones. So when I'm saying I have an order to things when I'm treating patients, it's hormones and gut. Before we even get, I call it the exotic part when it comes to the vector-borne diseases. If you're not sleeping, your hormones are impaired, and your gut is destroyed, it's going to be a challenge. It's going to be a challenge. And I want anyone to think about, especially so many Lyme patients who take 60, 70 supplements, $400 or $500 a month supplement bills, closets of supplements that didn't work, or they waste their money on, well, how is your gut health? How are your bowels? How are your bloating? What are you doing? It doesn't mean how many supplements are you taking for your gut. How are you treating your gut? And let's get support there, because that's the misconception. Oh, you have to get all these expensive supplements. There are protocols, I do, don't get it wrong, but we got to start with the basics.
Yeah, I often wonder, when you're on a high dosage of supplements. I went down that road at one point during my Lyme disease journey. And I often wondered, what if I'm sensitive to one or the other? And here I am taking all this stuff every single day, 2 and 3 times a day. And I often wondered if I was keeping myself sick, if I was actually sort of sensitive to anything, because I just didn't feel all that much better, even though I was taking all the supplements. But come to find out, it was probably my gut the whole time. So tell me, how many times should a person poop a day?
Oh man, that's the perfect question. That's such a good question. No one's ever asked me that.
And I've never asked
I
anybody before.
I know I always talk about gut. No one's ever asked me. I usually tell patients you need to look for at least one nice, firm, sausage looking poop a day. At least one. All right. It should be nice and brown. It shouldn't float. It shouldn't be pale. It shouldn't be loose. Preferably twice, because that's the way you detox. And if you're seeing things in your poop, if you're seeing food particles or parasites, you're in trouble. Or if you're having irregular bowels, I tell patients, you're a septic tank if you don't poop. You build up waste. That waste has to go somewhere. And glutathione and IVs and all that isn't going to help you get that waste out as much as having daily bowel movement. So if you're not doing that, then that's a problem. And a lot of times supplements can constipate you. Supplements can cause diarrhea. Foods can do the same thing. But I find patients are much more successful with their treatment journey when their gut health has been evaluated and it's been optimized, because let's make sense of things. I tell you, that makes sense. You can't absorb things that you're taking if your gut is imbalanced, and you're going to stay inflamed. What's the point? Just throw that stuff down the drain. It's not going in you anyway. So,
That's right. First things first. And you'll find that, now I can say, cut to, now I'm healed. I just make sure that I take my probiotic every day. And I take one that's a combination of a pre, pro, and post. Postbiotic, and it's all in one little capsule. And I'm a happy camper.
yeah,
I
and
just
that's important.
Yeah, it's really, really important. So before I let you go, I do want to talk about ILADS a little bit. I know that you are involved so heavily with ILADS, and I had the opportunity to go last year as a speaker,
And you
and
did great, by the
I
way.
thought
You did great.
I thought it was really interesting because I sat at a table with all people doing Lyme disease research, and they were all doing massive amounts of research. And I just felt so honored because I don't think the typical Lyme disease patient really knows and sees how hard everybody's working behind the scenes. And I was just really impressed. So tell me about your involvement with that, and what is ILADS to anybody who doesn't know?
So ILADS is the only physician-led educational organization for Lyme disease. It's the one of the oldest. It's the International Lyme and Associated Diseases Society. It's about 600 naturopaths, RNs, PAs, PhDs, MDs, chiropractor members who are health professionals whose goal is to treat and better understand complex chronic illness, because it's not just Lyme. It's not just vector-borne disease. Everything I'm telling you today, we all look at and we train, because we have training programs for doctors, and we just started our fellowship program for
Nice.
ILADS physicians to become fellows and be certified as understanding that Lyme affects the whole body. So we're looking at Lyme, mast cell activation disorders, multiple chemical sensitivities, parasites, gut health, detox problems, mold, environmental toxins. We look at everything. It's an organization of doctors and health professionals that look at complex chronic illnesses, because we also understand that these infections impact everything, and they overlap. So most of the providers, I call myself, yes, I'm a Lyme specialist, but I'm also a generalist, because I have to look at the whole person. And that's what the members of our society do. So we promote research, we fund research, we fund annual meetings and conferences like the one you attended, and you did such a wonderful job, and I appreciate your participation. We educate doctors and other health professionals in the community about complex chronic illnesses and vector-borne diseases. So it's our duty to do that. All right. We go before Capitol Hill. We advocate, because we know that this is an epidemic, chronic tick-borne diseases. We know that the testing is flawed, and so many patients go misdiagnosed or undertreated. So these are doctors who understand that chronic vector-borne diseases exist, that it affects the entire human host, and that it overlaps with other complex chronic illnesses. And I've been a part of ILAD since 2011. I'm treasurer now. I've been on the board. The Educational Foundation, which is our sister organization and responsible for providing grants and fundraising and supporting community outreach and conferences. So it's just a great organization. I mean, I think patients can get more information, physicians can get trained. I'm actually a training doctor where for 2 weeks, doctors train with a Lyme specialist, and you see everything I'm talking about today, because it's not just one thing that causes patients to be sick and causes vector-borne disease to be so prevalent and so aggressive. So we all learn together, and we train you and teach you. And it's www.ilads.org. And you'll find we have directory of Lyme literate health professionals all around the country, all around the globe. We just had our international conference in Lisbon, and the next one is in San Antonio, and we're having a regional conference in Philadelphia. So that's our mission. Our mission is to educate and to treat and to train other doctors. So even if you have a doctor, let's say you're listening, you're like, I don't know, I think I might have Lyme, but my lab request was negative. Well, you need to find someone else. You need to find someone who can listen to you and might be able to use proper or more comprehensive testing to determine the root cause, or someone who might look at the big picture and get down to why it is you're not feeling well. So yeah, so that's what we are. It's my family, it's my tribe,
I,
and
I
it's
love
a
the organization, and I think that the misnomer is that they're all conventional doctors.
no.
It's just not the case. And I was just so pleased to be involved in that. And I want everybody to understand, if you go to their website, they have a patient provider section, and you can actually see what doctors are ILADS, what providers might be in your area, but also, you know, send your doctor to the conference. If
Yeah.
you have a fabulous doctor that wants to learn a little bit more about Lyme disease, they can go to this conference, probably any one of the ones you mentioned, and attend. And when they go in, they're talking doctor talk. I mean, it was way over my head, but some of the research and some of the studies and the presentations and the information that they're getting, it's an entire 3 or 4 days of just inundating them with the truths and the science, and then also the treatments and what's on the cutting edge of treating Lyme disease and co-infections and complex chronic illness. And I think everybody should have this further training, as far as I'm concerned, if they're helping people in the world
I
out there.
agree. And I think more doctors, because we do physician kind of foundation courses at our annual meetings where we have one day just dedicated to giving you training, your doctor training in all vector-borne diseases and complex illnesses. It's fundamental training. And you go through that course. Then your next step, you get trained and you shadow a doctor, and then you become a fellow where you're like officially branded as a leader in the organization that you are an expert in this field. And then your job is then to go mentor others. So physicians, health professionals, chiropractors, nurses, PhD students, we are always looking to expand and explore and to get new members. And just because this is needed, right? This
And
how
it's
many patients have been dismissed? It's needed.
also great for you guys to see each other year after year and form friendships and network and
And
all,
learn.
and learn from each other. So
Yes.
thank you so much for your time, Dr. Cornish. I could talk to you for all day, basically. I really
Well,
could.
maybe I'll come back. You never
I
know. I'm always
you're
here.
gonna come back. You are definitely gonna come back, and I appreciate everything. Tell everyone where they could find you.
Yeah, so I'm associate medical director at Amen Clinics, and that's www.amenclinics.amen clinics clinics.com. 703-880-4000. That's our office number. I'm also on Instagram at dr.eboni Cornish, so Dr. Eboni Cornish. And I give a lot of free help and advice and tips there for patients suffer from complex chronic illnesses. It's only a professional site. And yeah, and online, I'm also found on YouTube as well, on the Amen Clinics YouTube site. So I'm always here to educate. As my kids say, you always break it down because they're 8-year-old triplets. They'll be 9 in a couple months. Or 8-year-old triplets. I try to make it easy for everybody
That's right.
to understand. So
Just condense everything and say it once, right?
exactly.
Thank you so much for your time here. I appreciate it, and I look forward to seeing you soon.
All right, we will see each other, and I appreciate all you do for the community. It's commendable, and someone needs to be doing this work. And I appreciate you inviting me to this. It was an honor and a blessing.
Thank you so much.
All righty, take care.
Thank you for listening to this episode of the LYME Time podcast. If you like what you heard, please subscribe on your favorite platform to be notified of new episodes. Remember, this is not intended to be medical advice. Take your findings to your provider to see if something is right for you. No two bodies heal the same, and your doctor knows you and your labs best. You can find out more about the Tick Chicks at thetickchicks.com, and if you subscribe there, you'll be notified of upcoming events like the in-person Losing Lyme retreat that I host. I also have shopping pages dedicated to helping your at-home symptom relief, as well as a private support group. Join the Tick Chicks tribe on Instagram, YouTube, Meta, TikTok, Pinterest, and X. You are not alone.